3 years ago, hundreds of doctors signed an open letter begging then-Victorian Premier Daniel Andrews to end his draconian lockdown. Now, many of those same doctors are asking for his successor, Jacinta Allan, and the federal government to conduct a COVID inquiry, a real, honest, in-depth royal commission. They argue an honest appraisal of the Australian pandemic response is vital, especially for Victorians who suffered most enduring the world's longest and most stringent lockdowns. Specialist anaesthetist Dr Eamonn Mathieson is one of those doctors, and he joins me now. Now, what is the problem with the current COVID inquiry that we've got that the federal government has tabled?
Well, thanks, Rita, for having me on. Well, it should be just remembered that the last 3 years or more have been an extraordinary time. It's probably the greatest social upheaval since World War II, and probably the greatest public health disaster in our history. And I think nothing short of a royal commission is owed the Australian public for the suffering that they have endured, for the policies that have been imposed upon them. And the current inquiry will not answer the questions that many Australians have about the policies that were implemented over the last 3 or so years, particularly in Victoria with the lockdowns, as you say, the most extreme lockdowns, not just in Australia, but across the world.
Yeah, 6 lockdowns. Now, you did try to reach Dan Andrews. Hundreds of you penned an open letter. Did he ever privately, even through a staff member, reach out and consult you about, because you were raising some very serious concerns about the devastating impact of these lockdowns?
Absolutely. We were gravely concerned at that time that the costs and harms of the lockdowns were far outweighing and would far outweigh any of the possible benefits that they would confer. We did reach out. We were basically ignored what we said. I think we have been vindicated about our position because of the evidence that has now come to light and some of the independent reviews that have looked at the costs and harms of the lockdowns, and also the impact that they had, which was, compared to other states, absolutely minimal when you look at what happened in 2022 and the stats on both the cases and the deaths and the hospitalisations, etc.
Yeah, Victoria had the worst outcomes as far as deaths per capita, plus the longest lockdowns and just devastating impacts, societal impacts and the impact on children, the health impacts, people not getting their screenings and having the early medical intervention. Absolutely. Have we learnt anything, not just Victoria, but really the entire country? Or if another pandemic were to hit, are we going to go down the same road?
They're great questions. There has been independent cost-benefit analyses done, but it's interesting that the government has studiously ignored them. They didn't do the cost-benefit analysis beforehand, and if they did not share them. They were kept secret. People like Professor Gigi Foster from the University of New South Wales has done her own independent review of the cost-benefit analysis, and what she found extraordinary in her book is that best-case scenario, the costs and harms were 68 times greater than any benefit that they could have conferred. And that's best case scenario, and that's taking all factors. But we knew this beforehand, and the public health guys should have known this. In fact, the pandemic preparedness plans were thrown out the window in March of 2020. So lockdowns were rejected prior to 2020. In fact, in 2019, the World Health Organization wrote a document expressly rejecting the concept of lockdowns, and yet this was jettisoned in a moment of fear or panic or whatever it was. But the cost to the Australian public has been immense. And I think that they are owed a serious inquiry, not this, what appears to be, and what Peter Dutton referred to as a farce, a whitewash, that is not going to actually ask the serious questions of the decisions and the public policies that have caused such harm to Australians, particularly Victorians.
Absolutely, and I think we need it not just because of what we've endured, but to avoid it all happening again, because it was such an enormous failure of the expert class, the public health bureaucrats and everybody else who unquestionably went down this road copying the Chinese Communist Party model as opposed to our advanced pandemic plans. Dr Mathieson, thank you so much for your time and your advocacy. You were one of the brave ones who actually, at the time when it mattered, put your name to these letters to the Premier raising these issues.